go.
Ah! No, he did not do it like that. TLC, please. I volunteered. Like, I'll do your commentary next time. It's going well for us. That's not possible. Hey y'all, welcome back. It's everybody's favorite time of the month. Much better than that other time of the month where we review an episode of TLC's famously entertaining Didn't Know I Was Pregnant and ruin it with educational commentary. Today's episode is one of the oldest episodes of Didn't Know I Was Pregnant and features one of the oldest first-time parents that I think we've seen in all of our time watching these. How much effort does it take to conceive and carry a pregnancy to term or viability well into your 50s? Let's find out. You're gonna wanna watch this one. Thank you to ZocDoc for being the sponsor of today's video. We'll hear more about them in a minute.
Oh, look, it's that little girl.
For us to have a baby, it was the icing on the cake that would make our life complete.
Okay, first off, casting, excellent. That does look like her. However, I don't think she looks quite as old as they cast her to look, and they did her dirty on that because they really wanted to lean into the we are not young, sprightly teens anymore.
It'd be nice to have one of them of our own. Me and you, I'm going to take that smile as a yes.
Unfortunately, although Nick is 43, Susan is 54 and postmenopausal.
The age difference, we knew it would be hard.
The only way that she will be able to conceive is through in vitro fertilization, or IVF.
And I'm already perplexed as to how this is gonna play out, not knowing you're pregnant when you've done IVF, but carry on.
What's this thing?
IVF?
But British medical standards discourage IVF for postmenopausal women.
I just think I'm too old for that now.
No.
But then Nick,
The complications that a lot of people worry about with pregnancy past 35, 40, 45, whatever, the things that first come to mind for a lot of people are pregnancy loss, miscarriage, stillbirth, genetic abnormalities. Most of those are actually able to be easily mitigated with donor eggs. So if you've gone through menopause, then you're not going to be using your own oocyte or egg for conceiving. And the donor egg being of a younger reproductive age will mitigate the fetal complications that come along with it. But anything that's related to the placenta, the uterus, the person who is pregnant and their risk of complications, that can't be mitigated by egg age.
What do you think?
I think we should do it soon. Yeah, let's go.
Hello.
In May of 2005, Susan
stressed.
and Nick traveled to a Russian clinic that's willing to do the procedure.
That's already a problem, right? Because they had to go out of the country to somewhere willing to do IVF. So the data must be pretty convincing that that is potentially dangerous.
so we went to Poland, and my first IVF donor egg was in Poland.
First, Susan must start a course of the hormone progesterone to thicken the lining of her uterus.
Sorry, what? Hang on. That's not right. I'm going to go back because I cannot believe they would have such a distinctly inaccurate... I just need to make sure I didn't hear this wrong.
First, Susan must start a course of the hormone progesterone to thicken the lining of her uterus.
We've talked about this so many times. What is the hormone that thickens the lining of the uterus? The one that is dominant in the first half of the cycle prior to ovulation. That is estrogen. In all likelihood, they would need to be giving both, but the thickening the uterine lining part and the postmenopausal, I don't have enough estrogen part, those go together. So the medication that she needs to be on prior to transfer, progesterone is important. It's progestational. That maintains the lining. But to thicken the uterine lining, you need estrogen. And then progesterone is added in to maintain it, keep it stable. Because remember, we've talked about this so many times. Look, I have a helper today. It's so good. He built the stand for that. It's very nice of him. Right, so you see the first half of the cycle prior to ovulation. Then estrogen is, I don't like this because it goes upside down, but estrogen is higher in the first half. That's to thicken up the uterine lining. Brad will yell at me if I'm far away and the mic can't hear me. And then progesterone comes in the second half as a stabilizing hormone to keep it where it's at and not allow shedding. And then if you don't get pregnant and at the end the progesterone drops off drastically, then you have a menstrual cycle and the whole process starts again, unless you're menopausal and doing it all with injections, and then it doesn't start again. I can't believe they got that basic fact so
It was
wrong.
quite intrusive. That was like injecting myself in the stomach and taking tablets.
The egg is fertilized with Nick's sperm and implanted in Susan's uterus in September of 2005.
I don't like when they use implanted in the uterus. It's not. So what they do basically, if you're doing a donor egg, then the egg retrieval would have been from another person, and that egg is probably frozen somewhere. So they thaw the frozen eggs, they do sperm collection, so it goes through a washing process and things. You need an embryologist, it's a whole thing. And then they basically put them in a petri dish together and let the fertilization happen. Or they could do something called ICSI, which is intracytoplasmic sperm injection, which facilitates the process of fertilization. I'm not a reproductive endocrinologist, but from what I understand, the choice depends on several factors, including how healthy the oocyte looks and if the zona pellucida, which is the outside of the oocyte, we don't have one on there, if it looks like it might need help to facilitate fertilization, they'll do it via a needle. It's really cool. You look at it under a microscope. I did some mice embryo research in residency. You like look at it under the microscope, and then you have this teeny tiny needle that has one sperm in it, and you just put it through the outside of the egg and inject it. We got to find a video. Should we find a video? We should look at a video. It's really cool. So this outside part here, this is the oocyte, and this outside part here is the zona pellucida, and this is a cell, and they're going to inject it into the cytoplasm of the cell. So they've got the needle through, and then you can see the sperm travel down. This little thing here that on this side, I think you can see my mouse, yeah. It is like it's almost like a little straw thing that has a blunt edge, and it's to stabilize the oocyte. We use them for embryos too if we need to do manipulation. Anyway, it's pretty cool. I'm not a fertility doctor. I don't do this on a regular basis, but I did some of it in residency and I enjoyed it, and I am a nerd, so I find it very cool.
Almost 2 years later, in 2007, they receive a phone call from Russia.
Hello? Oh. Hello, doctor.
They'd found suitable donor eggs.
That is concerning to me that they would call them 2 years after they had left wherever they live, and I think the UK, and go to Russia because no one in the UK would do the procedure for them. And then 2 years later, they call and say, actually, we have another egg if you want to try.
Susan and Nick will have to make an immediate decision. The donor eggs have already been harvested and will need to be implanted within the next 12 to 14 hours before they...
12 to 14 hours is short notice.
Within hours, Nick and Susan are at the Russian clinic, where 3 donor eggs are fertilized with Nick's sperm.
This is impossible. They wouldn't, she's menopausal, right? Didn't it say she's already gone through menopause? Like, you couldn't just, in a matter of hours, show up and have the procedure done. Like, she have to be on something to stimulate her uterine lining. That's not possible. I don't know if this is just a lot of inaccurate information or the couple is not telling the truth. This is bizarre. But you can't just transfer an embryo into a postmenopausal uterus and expect it to work.
After 5 agonizing days of waiting, the couple braces themselves for disappointing news.
Come on, Suze.
I did a pregnancy test,
Pee faster.
Well, what is it?
and sort of suddenly she added to Nick, "Oh my God, I'm pregnant."
We're pregnant.
We did it!
A+ acting every time.
We did it!
I love this show for that.
In August of 2007, Susan experiences a frightening event.
I started to bleed quite profusely.
Suze, what's going on?
Thank you.
Susan keeps hemorrhaging so heavily that she calls her doctor.
What did he say, Suze?
He thinks I've had a miscarriage.
True or false? You should eat twice as much as normal during your pregnancy to ensure a healthy baby. The answer when we return.
As a doctor, I see how delays and poor quality care make it hard for people to prioritize their health every single day. And honestly, I've been there too. There have been moments where I have stopped in the middle of trying to make an appointment because it was just too much of a headache. I mean, we live in a world where you can order groceries or book flights or even buy a car online in minutes, but when it comes to making a doctor's appointment, it's like we're stuck in 1995. And let's be real, most people don't stay on top of their health because of these very same headaches. We wait until it's urgent, and then things are more complicated, more difficult, and sometimes more expensive. That's why I'm so excited to once again be working with the sponsor of today's video, ZocDoc. ZocDoc is a free website where you can find and instantly book appointments with high quality in-network doctors. Therapist, gynecologist, eye doctor, maybe you need a dentist. Whatever it is, ZocDoc has you covered. Using ZocDoc, you can see the information that actually matters to you, like real patient reviews and appointment availability. Whether you need a female doctor, an LGBTQ-friendly doctor, or maybe even just someone who is really close to where you live, ZocDoc makes it easy to find what you need. Then you just pick an appointment time that works for you and book it right there online, sometimes even on the same day that you're searching. ZocDoc has over 100,000 healthcare professionals spanning nearly every specialty, so they make it easy to find anything from an appointment for a routine checkup to something a bit more urgent. So if you've been putting off that pap smear I keep reminding you about, or you're needing a quick consultation for something a bit more acute, ZocDoc takes the headache out of making appointments and helps you get the care that you deserve when you need it. So if you'd like to take control of your health and support my channel in the process, you can go to ZocDoc.com/MDJ or click on my link in the description box down below. Prioritize your health and make it easier on yourself using ZocDoc to get the quality care that you deserve. Now, let's get back to the video.
True or false? You should eat twice as much as normal during your pregnancy to ensure a healthy baby.
False. You can't eat twice as much to keep a fetus alive. You just need like a little more calories, a small amount more. You probably shouldn't even really notice that you've changed your eating habits, except that hopefully you're making healthy choices.
The gynecologist that I'd seen in England, and he said, you've obviously miscarried.
To make matters worse, Susan's heavy blood loss continues throughout the fall of 2007.
Good question in the chat. It says, is it realistic that she could potentially lose one pregnancy and still have another, like if she had a twin pregnancy? And yeah, you can. You can definitely have a miscarriage with one of the twins miscarrying and the other not. That can actually happen at any point in pregnancy. And there are cases of twins that have been actually born in different months even, because one came way too early and they were able to hold off on the second one. That being said, it's much more likely that the symptoms she's experiencing, given that we know it's not a miscarriage because of the show that we're watching, it's probably something called a subchorionic hematoma or a subchorionic hemorrhage, which is where the placenta gets some bleeding behind it, and that can cause uterine irritability, which causes cramping and can cause bleeding. That does increase the risk of miscarriage or pregnancy loss, but it also can happen and go on and on through the whole pregnancy and someone has a normal term pregnancy. It also increases the risk of preterm delivery and your water breaking really early and things like that. But again, I've also had plenty of patients who've had subchorionic hematomas or hemorrhages and bled every day of the pregnancy and had a term healthy baby. So there are risks that come along with it, and it does increase the risk of pregnancy loss, but it's not always the case. Why did nobody do an ultrasound or pregnancy test to see if she actually had miscarried? Like, did she actually just call someone on the phone and they said, oh, you're bleeding? Probably a miscarriage, and nobody checked anything else? This is bonkers. That's malpractice, honestly.
Finally, in late January of 2008, Susan makes an appointment with a different doctor.
As she should.
So what's going on?
I burst into tears and said, I'm constantly tired, I feel really ill, my stomach is quite swollen, I've lost all this weight. I know my own body, something isn't right.
Well, let's take a look, shall we? See what we can find. Just lean back for a second.
During his examination, the doctor discovers a suspicious abdominal mass.
She has a suspicious abdominal mass, which is, you know, not suspicious at all if you consider the fact that she did IVF, had bleeding, and nobody, you know, did an ultrasound or checked a pregnancy test. They just decided it was a miscarriage.
He orders an immediate ultrasound.
It's gonna be a baby,
While
guys.
waiting, Susan discovers the doctor's terrifying suspicion.
He probably thinks it's cancer.
On the form that said, question mark in capital letters, suspected ovarian cancer.
Because she's in the age group for
Cancer
that,
of
not
the
pregnant.
ovaries is the most deadly form of female reproductive cancer. By the time it's detected, it's usually too late to be effectively treated.
It's a good learning point. Ovarian cancer is a very devastating diagnosis because we often, almost always, cannot even see any symptoms or diagnose it before it is quite advanced. There's no like screening that you can do to check for that. It's just when it becomes symptomatic, that's when it's diagnosed, and usually by then it is at least stage 3. Getting an ovarian cancer diagnosed less than that is pretty unusual. And she does fall into the right age group, and this is how they often present, with changes in bowel habits. The weight loss speaks more to that than pregnancy. And now she has a suspicious abdominal mass, which I suspect is going to turn out to be, a heartbeat and not a cancer. But it makes sense why the medical team, being new to her situation because she's seen a new doctor, wouldn't first think, oh, maybe it is a baby, right? Because she thought she miscarried. For whatever reason, nobody did appropriate workup. And now this doctor wouldn't have any reason to have pregnancy be at the forefront of their mind.
Susan has just found out that she's not dying from ovarian cancer, but pregnant at the age of 57. 29 and a half weeks ago, Susan was implanted with 3 fertilized eggs. What she didn't realize was she miscarried 2 of them.
That would not be typical practice now. I think they said this was the early 2000s, so that's not surprising. But single embryo transfer, SET, if you have a healthy looking embryo, then you generally, until somebody has like failed IVF several times, are going to try to transfer 1. This has been an effort from the fertility community based on data to decrease the chances of higher order and multiple pregnancies, which bring on multiple risks. Particularly in someone her age, this is stupidity. She's using embryos that are a normal reproductive age where there shouldn't be an increased risk of loss related to that. And she's in her late 50s, which means her uterus has been menopausal and does not have as much estrogen stimulation over the past decade. So transferring 3, if she ended up pregnant with triplets or more, could be detrimental and lead to no take-home babies. So that should not be done with donor eggs in her situation. I'm laughing because I am picturing, I don't know how this unfolded clinically, but please play it out with me, right? She's 57, 56. This is a new doctor that she went to see. And if she didn't say, by the way, I did IVF last whatever month, and didn't tell him that, and then they think she has cancer, but actually turns out it's a baby, I would be like, this scan is wrong. I'm just imagining myself having a postmenopausal person come in and not tell me they've done IVF, and we think they have cancer, and then it's a baby. And before I talk to them, I'm trying to work through how, why. Oh my gosh, I think I would just probably sit there and stare at the scan. I would probably call the radiologist and be like, did you mix up my patients? I hope she told them and they weren't just sitting around confused.
Nick arrives at the hospital thinking his wife has just been diagnosed with ovarian cancer.
Oh, Sue.
I was dreading to hear what the news was. She said, you better sit down and have a coffee.
Oh, I forgot he wasn't with her. Oh my gosh, can you imagine? She's like, you need to come right away. I have cancer. And then he gets there and she's like, remember that miscarriage? It's a baby. When people get pregnant, when they're like perimenopausal, I always wonder how that conversation goes of like, oh, I thought I was in menopause, but my menopause had a heartbeat actually.
Well, I had the ultrasound. I haven't got cancer.
Please tell me this is not how she shared that news. Like, come on, they wanted a baby really bad. How could you be that calm? I would have been like, wait until you hear what this is.
That's fantastic.
But we're pregnant.
29 and a half weeks ago, Susan was implanted with 3 fertilized eggs. What she did.
I love the actors in this. He looked like he was gonna punch her. Look at his face.
We were just absolutely over the moon because we'd given up all hope.
I think I needed a whiskey.
Isn't that amazing?
Our baby.
He's like, I needed a whiskey because I actually was gonna punch her. Because she couldn't just lead with, it's a baby.
On March 25th of 2008, Susan is prepped for the cesarean.
The only difficult part was when they gave me the epidural because you feel the coldness
We
coming.
don't usually do an epidural for planned cesarean delivery, so she's probably referencing, and it's okay for her to call it that, but from a medical standpoint, she probably had a spinal because we usually only use an epidural for labor. The difference between those is the epidural goes in the epidural space and the spinal goes in a different place in the spinal canal. But it also makes a difference as to the level of numbness that you get and how long it lasts. So an epidural is placed almost like an IV. You leave a catheter in where you can put more medication in, but it's generally dosed where the goal is to still be able to have some movement and some feeling so that when it comes time to push, you can still feel where to push and do so effectively. A spinal is meant to last a defined and shorter amount of time, like 2 hours, and to give you full sensational numbness from a certain point down. You can still feel movement, and it's a very weird feeling, actually, having had a few C-sections myself, but you shouldn't feel pain with a well-placed spinal. It's much more effective pain control for a C-section than an epidural. Now, you can also use an epidural that has been placed, like, say, in the course of labor, for someone who ends up needing a C-section and wasn't expecting it. You can still use that, dosed up higher for a cesarean delivery. It's just more likely to fail or to have hot spots or places where the patient can feel things, which means there's a higher risk of needing to convert to a general anesthetic or being asleep.
Susan's age makes the procedure especially high risk for both mother and baby.
I'm highly bothered by the fact that that doctor does not have eye protection on during a surgery that is known to be quite bloody. Average blood loss in a cesarean is like 700 mL, so that's concerning.
While Susan is numb from the epidural, the doctor delivers a 6-pound, 6-ounce baby girl by C-section. Since Susan didn't find out she was pregnant until 29.5 weeks, doctors are still unsure of the baby's health status.
Look, she had a 2-month-old. That baby is pissed. It's like, why did you cover my head in this red paint? Why am I cold? Why am I naked and wet? Please give me back to my mother and let her feed me and put me back under a blanket or skin to skin so I can be warm.
Are you ready to cut the umbilical cord?
Nick cuts his daughter's umbilical cord.
You're going to cut right between those 2 clamps. There you go.
No, he did not do it like that. She's gonna die from an infection. He doesn't have gloves on. He's not sterile. Stop it right now. That's not what happened, and if it did, I am very sad. I do have ways that I let patients who have a support person that wants to cut the cord during a C-section do that, and ways that you can, in some situations, do that sterilely without having it be like a trim the cord on the warmer situation, which is also fine. But it's not like that. That is I'd be like, excuse me, you've breached my sterile field, get out of the OR. I don't like that. I'm uncomfortable.
So how is it possible that Susan didn't know she was pregnant?
This is the first one where I'm like, it's the doctors. They're the only reason that this happened, and that's terrible, and I'm angry because that is an easy thing to work up appropriately.
Against all odds, both 58-year-old Susan
Yes,
and
this
her
is my
now
favorite part of these.
9-month-old
Oh,
daughter
it is so
Freya
cute.
are perfectly healthy.
The last 9 months has been the best part of our lives.
That was fun. I love these. I hope that you learned something today. If you did, leave it in the comments down below. If you're not subscribed and you want to be, please subscribe. We film these on Twitch. I don't know if you know this, but they're very fun streams. Catch us on a stream sometime. Or if you want to see the streams, you can become a channel Membryo and you can have access to all the full-length streams. Or just watch the videos when we post them. I'll see you next Monday. Don't forget to check out ZocDoc, the sponsor of today's video, by going to my link in the description box down below.